participants, we recruited 1,537 women from different Emirates in the UAE. And the study setting a population where, as I said, women living in the UAE, including both Emirati and non-Emirati women. For the inclusion criteria, we include, as I said, women capable of consenting, can read and write both in either in Arabic or English, living in the UAE 18 years old and above. Those who did not fit the inclusion criteria were excluded, and we have been given the approval, or the ethical approval was obtained from the Research Ethics Committee at Zayed University in Dubai. So here are some key results. Actually, as you see, the majority were aged 20 to 29 years at 53.5%. Almost 90% were Emirati at, yes, as I said, at 90, which approximately 88.9, which is close to, we can say, almost 90%. Actually, 48.1% were residing in Abu Dhabi, and 88% were in urban areas. 82% of the women were married, and 51% were holding a bachelor degree. For the employment status, almost more than 50% of the women were unemployed. For the chronic diseases, actually, we asked the women if they have any chronic diseases. Most had no history of chronic diseases at 68%. For diabetes, actually 109 women at 7.1% said that they have this problem. For migraine, it was 7.6%. As clear here, this is the diabetes, 7.1, and the migraine was 7.6. For the level of physical activity, it varied 1 to 2 times per week at 40%, 3 to 5 times per week at 19%, and daily at 5.4%. Actually, 30% reported being inactive or rarely active, and 23.8% were pregnant. For the breastfeeding, we had 13.3% of the total participants. When we ask about which type of physical activity is recommended during pregnancy, 80% of the participants selected walking, 31 went for swimming, 11 selected running, and only 1% selected yoga. As it's clear here, this is 31, 80 for walking. 78% agreed that some types of physical activity should be avoided during pregnancy. And many of them believe that physical activity during pregnancy could decrease the risk of gestational diabetes at 60%. Here we have the gestational diabetes. Okay, and enhance. So at 60% for enhancing the cardiovascular system, it was 51%, they agreed that the physical activity could reduce the cardiovascular complications or could enhance the cardiovascular system. And actually, for providing better sleeping patterns, yes, 41 agreed. In helping managing weight gain, 38% they agreed on this aspect. And for improving the respiratory function, it was 37%. The main knowledge of the participants was 40.6 plus minus 20.1, with maximum score being 92.9 and the minimum score being 7.1. This indicates a below average level of knowledge overall. Older age, being married, higher educational attainment, and absence of chronic disease history are all significantly associated with higher knowledge index scores. A regression model was used to further analyze the variables. We have found that being younger in age, having a lower education level, being employed, and having a history of chronic disease were significantly associated with lower mean knowledge score. Moreover, being married was significantly associated with higher scores. As it's clear here, we have found that 90.9% of the participants agreed that physical activity benefits both the mothers and the children. 80% agreed that mothers without pregnancy complications should begin physical activity or exercising program during the pregnancy. 85 agreed that pregnant women who used to be physically active should be encouraged to continue a physical activity program or exercising program throughout or during the pregnancy. And at 69%, women agreed that physical activity during pregnancy increases the risk of low birth weight babies. And at 70% agreed that the possible harmful effect of physical activity during the pregnancy on the fetus are minimal. So we have some other key results according to the questions that we ask the women. So for the statement, physical activity during pregnancy is beneficial for both mothers and infants. Those who were older, were married, had a high education level, and had no chronic diseases were more likely to strongly agree or agree with the statement. For another statement, which was pregnant women who used to exercise should be encouraged to continue an exercise or physical activity program during the pregnancy. Those who were older or were from obesity, were married, had a high education level, and had no medical history, were more likely to strongly agree or agree with the statement. And for the statement, physical activity during pregnancy increases the risk of low birth weight. Those who were unmarried, were employed, and had a high education level were more likely to strongly agree or agree with this statement. For the discussion part, actually, as we said earlier at the beginning of this presentation, The level of the physical activity among women in the UAE is low. Our findings support recent studies indicating that physical activity levels are low in the Arab region, okay? And the UAE is no exception. The situation has not changed over time as indicated by earlier studies of physical activity undertaken in the UAE. Reports also suggest that levels tend to be low among women. Our findings suggest that the participation in regular physical activity by Emirati women may decline or stop completely with pregnancy. We also found that women in the UAE are becoming increasingly sedentary. This claim is supported by a recent study of physical activity and sedentary behavior in a young UAE population. As all of us know, it is widely acknowledged that knowledge and beliefs relating to the benefits of or risks associated with the health-related behavior positively mediate behavioral intention and practice. When asked whether regular exercise or physical activity was safe during pregnancy, 1/3 at approximately 36% agreed that it was not harmful. It is safe. When asked about which type of physical activity is recommended during pregnancy, the majority at 78% agreed that some forms of physical activity should be avoided during pregnancy, while walking at 80%, swimming at 31%, and running at 11% are, however, acceptable. Only 1% of women mentioned that yoga is safe to undertake during the pregnancy, although this is not surprising given that it is not common or widespread in the UAE. According to the American College of Gynae, walking, swimming, and yoga are the safest options for physical activity during pregnancy and moreover can easily be incorporated into most lifestyle. Thus, a future campaign promoting physical activity during pregnancy in the UAE might specifically encourage greater awareness about its safety and health benefits. Compared with other published studies, the overall mean index score for knowledge of 40% is lower than expected, although consistent with similar research based on the lower than expected levels of knowledge reported. This may be increased for women who are younger, below 20 years, become pregnant in their teen years, are of lower educational attainment, are employed, or have a history of chronic disease, since these factors were significantly associated with lower mean knowledge score. On the other hand, being married, being of higher age may be slightly protective, in that these were significantly associated with higher knowledge scores. Thus, future planning of awareness raising on health education campaigns might usefully target younger, unmarried, unemployed, and student subgroups. Furthermore, women at 21% believe that amniotic fluid and thus the health of the unborn are adversely affected by physical activity. More research into the health beliefs of Arab women, especially in Gulf countries, and carefully targeted messages that acknowledge alternative belief system are recommended for this region. Finally, since knowledge and attitudes are essential predictor of mediators of behaviors, including physical activity. Greater involvement of midwives and physicians in improving safe physical activity is highly recommended. As previous studies showed, some professional lack of confidence in raising issues of diet, physical activity, or gestational weight gain with mothers to be for fear of upsetting them or undermining their confidence. Therefore, professionals involved with childbirth should receive adequate training. These are some strengths and limitations of our study. So the strengths are using questionnaire, as you know, is cost effective, time efficient. Okay, and choosing, we went for snowball sampling, which allows us for quick and easy sample collection. Limitation, physical activity level will self-reported. This study did not further investigate the parity, gravidity, the status of the participant in terms of former pregnancies, the status of current pregnancies, the number of months antenatal or postnatal, the number of children, and knowledge of how many were mothers. Investigating the socio-demographic variables associated with the physical activity levels would have provided a better understanding of behavior among women in the UAE. So this is the conclusion. Our findings suggest that most Emirati women are aware of the health benefits of physical activity during pregnancy, yet few women of reproductive age participate in physical activity, and this appears to decline further during pregnancy and lactation. Knowledge surrounding the safety of physical activity and exercise is lacking, given the health benefits of physical activity during pregnancy. Women living in the UAE could benefit from clear advice about safe physical activity during pregnancy. More research utilizing behavioral theories may increase understanding of how physical activity or physical activity behavior is mediated in the socio-cultural context. Understanding women's knowledge and beliefs will help inform future intervention or messaging campaign and demands relevant approach. Thank you so much for your listening.